time for our weekly NFL injury report. And for that, we'll welcome in Dr. Steven Stoller. And always good to catch up with you, Doc. How you been?
Good. How you doing, Rich?
I'm doing
Thanks for having me on again.
Always a pleasure. I'm doing real well. All right, let's get through the gamut of some of these players. Let's start with Tevin Coleman, the Falcons running back. And I don't know how much insight you can add on this, but you've got a situation where he's dealing with sickle cell issue, might not play in Denver with that mile-high air. And we've seen Ryan Clark in the past, who played for Pittsburgh, didn't want to play in Denver because of this. I mean, how much caution do the Falcons and Coleman, how much caution would they have to take here?
Oh, I think they're all doing the wise thing. Sickle cell anemia is your red blood cells carry hemoglobin, and the hemoglobin is what carries the oxygen to the body. And hemoglobin is round and flexible. Sickle cell patients, the hemoglobin is shaped like a sickle, and it's rigid, and it can produce clogging of small blood vessels. So the things that will aggravate it is stress, dehydration, and high altitudes. So he could certainly have a sickle cell crisis just by visiting Denver or any high altitude. And that causes severe pain, and it could also produce temporary or permanent damage to whatever organ is being deprived of oxygen. So I think it's a wise decision.
Yeah, it certainly seems that way. Eric Decker, Jets wide receiver, dealing with a partially torn rotator cuff, didn't play in Week 4. We talked about this last week. If there is a concern with him going out there, could he increase the severity of the tear?
You know, he could increase the severity of the tear, but this is my feeling that he has a partial rotator cuff tear, which you usually don't see in young athletes. It's usually due to instability of the shoulder, and the rotator cuff functions by pushing the shoulder or humeral head down with overhead activities. And just like with pitchers, if you have some instability, you're going to have a rotator cuff. You don't see rotator cuff injuries like this in, normal population. So I think the pain that he's getting is due to bursitis, and if they injected that, he could certainly go out and play. And I would recommend, if he's still symptomatic and not improve with therapy after the season, to have both his rotator cuff repaired and the instability repaired at the same time. Because remember, Chad Pennington had a similar situation, and they repaired his rotator cuff. They did not repair his instability, which is really the primary problem. And so if you don't, and that was fixed the next year. So he ended up losing 2 years as a result of the injury.
Again,
so I think he could play if he was injected. I think he could play.
Okay. Again, a couple minutes with Dr. Steven Stoller from the American Orthopedic and Sports Medicine in Englewood, New Jersey. And, of course, check him out online, drstoller.com. Give him a call to book an appointment, 201-261-2000, as we are doing our weekly NFL injury report with the good doctor. All right, let's move along. We'll go to one wide out to another. Des Bryant missed Sunday's game against the Niners. The injury was first thought to be an MCL sprain, ultimately diagnosed with a hairline fracture of his tibia. There's belief that this injury isn't a true fracture instead of a bone contusion or bruise. First of all, for the listening audience, is there a huge difference between a bone from a contusion and a bruise between those two?
It's really the same thing. Okay. It's just, it's medical language versus, typical language. And prior to MRIs, we never saw these injuries, so we never treated them anyway. The problem here is that the MRI demonstrated a hairline fracture, and the MRI is not accurate for showing fractures. And with the amount of pain, and again, with any professional athlete, or for me, for any patient, I would get a 3T 3D CT scan, and that will show the full extent of the fracture much clearer. It's three-dimensional. You can move it around your computer, and you can even have it made into a model. So you could see if the fracture enters the articular weight-bearing portion, and if it does, or it's more extensive than thought, then he shouldn't be playing. And right now, I hear he's practicing in pain, so I think it has to be more serious. And so I don't know why that's not being done. And if it is like in position, meaning non-displaced, my recommendation would be to inject the bone contusion at the fracture site under X-ray control with a bone-absorbing cement. This way it will heal, and the cement will then absorb, and he'll be able to return much sooner.
Okay, so then the healing process, recovery time is a lot quicker.
If you do this,
if you do the latter.
But if you don't and you ignore it, he's going to have permanent problems.
Trevor Siemian, Broncos quarterback, suffered a left shoulder injury against Tampa. They said he was questionable entering this week. They're trying to push him. They want him to play. It appears he injured the AC joint. It's in his non-throwing shoulder. So, again, I would venture to guess he could play with that issue. And, again, for some of the listening audience, maybe they dealt with this. But kind of explain that injury to the AC joint.
Okay. The AC joint is called the acromioclavicular joint. The acromion is the bone that's on the top or the tip of the shoulder blade, which is called the scapular. And the clavicle is the collarbone, and that at the end, when it reaches the shoulder blade, forms a joint called the AC joint or acromioclavicular joint. They're held together by two major groups of ligaments, and that's how you get the different degrees of separation of what ligaments or both ligaments and how far there's a separation of that joint. Now, my understanding is I didn't see an MRI ordered. I'm assuming that they're basing this on examination, so that would mean a grade 1. It would mean that it's like a 10-day rest period, and being that it's non-throwing arm, if he did have some pain, I would just inject him with a long-acting Novocaine and follow him.
Again, our weekly NFL injury report with Dr. Steven Stoller from the American Orthopedic and Sports Medicine, Englewood, New Jersey. Check them out online. They have all the information on physicians, Q&A, testimonials, patient education, where you can actually look at some tutorials and videos and get a better understanding of injuries and, of course, maybe the road to recovery. You know what? Let me ask you this. Because we might spend a couple minutes on this to close it out. I think this one's a little more important. Non-football related, let's go to the NBA because the Sixers are right in our backyard. Ben Simmons just had surgery on his ankle. And, a lot of people believe he potentially be in the running for Rookie of the Year. Now, that right foot injury turned out to be a Jones fracture. There were reports that he just rolled his ankle at first, the final day of training camp. That wasn't the case. So a Jones fracture, successful surgery. They said it's going to be 3 to 4 months of recovery in addition to the surgery. Okay, what is there a good prognosis here for Ben Simmons?
No. Or there could be. A Jones fracture is a fracture of the fifth metatarsal. That's on the side of the foot where the pinky toe is. And it's notorious for having a poor blood supply, and that's why it doesn't heal. And it's one of the fractures that even if it's not separated, surgical treatment is always recommended. And to tell you the truth, I'm not certain whether or not it's an acute fracture. I usually look at these as, especially in athletes, that probably had a minor stress fracture, had some symptoms, minimal symptoms, and this just produced it, because it's not a common area to have the fracture without having that first. And they always look the same. They're like transverse fractures. Now, the treatment, I know that he had it already.
Mm-hmm.
What they do is inside the bone, it's hollow. So there's a fracture, and they make a small incision at the tip of the bone. They put a wire down the canal, so it's inside the bone. They use X-ray to determine the position, and then they drill it, and they put in a 4.5 millimeter screw. That's the common treatment. Now, in athletes, the failure rate is 83%. And I think, like, if you know, I mean, I think you mentioned Duran.
Yes.
We know Cartwright.
Yep.
I mean, there are, and I could tell you for years I
didn't mean to interrupt you. I'm just curious. They said he put on a substantial amount of weight. There was reports that it was 33 pounds of muscle, then 17 to 20 pounds within 3 months. I understand he rolled the ankle, but stepped on another player's foot.
I'm not certain that. I mean, that may have. I'm
just saying we can dismiss the fact that if he got stronger and put on muscle, there's more wear and tear.
No.
Okay.
No. This takes a long time for it really to produce.
Okay. What about the healing rate though? So I mean.
Well, the healing. Okay. Once the screw's put in, it's just a matter of waiting. And normally, you end up with second and third surgery, and you watch the X-rays, and they don't improve, and it gets very frustrating. And you could try bone stimulators. You could inject it with stem cells. But recently, there's a company that produced a screw that's 6 millimeters in diameter, and it's a titanium screw that's not cannulated. Now, what that means is that you have to drill the hole to put down the canal in the perfect position, because there's no margin of error. Right. So it's more difficult to do. But I've done half a dozen of these, because it's recent, and every one that I've done have healed completely in 6 to 8 weeks.
That's good prognosis. I mean, that's good recovery time.
And prior to that, using the regular technique, I would have to go in there and repeat surgery and bone graft.
And that's certainly, they don't want that. Hey, excellent stuff. As always, Dr. Stoller, great insight on Simmons as the rest of these other interviews and players, I should say. All right, my friend, we will talk to you next week, same time. All right, you got it, pal. You got it. Enjoy your weekend. Rich. You got it. All right,
Bye.
Dr. Steven Stoller. Very interesting stuff from the American Orthopedic and Sports Medicine.